Hi, this is Dr. Jennie Byrne. I'm an adult psychiatrist at Cognitive Psychiatry of Chapel Hill, and today I wanted to talk with you a little bit about a non-stimulant treatment for ADHD in adults. This medication is called Guanfacine. Other names for it are Intuniv, which is a once-a-day formulation, or 10X, which is a once or twice a day formulation. So why is it important to know about this medication if you have ADHD? Most people hear a lot about stimulant medications, which are things like Ritalin or Adderall. These are medicines that you take that have a very quick effect on ADHD, and they're relatively short-acting, so they wash out of the body and you feel it. And depending on the form of Ritalin or Adderall, you have a different duration of action. These medicines can be really great. They can have some problems with them, like side effects, trouble with appetite or sleep, feeling moody, or kind of having your mood be very flat. They can also have kind of a crash when you come off of them, where you get kind of irritable and tired. And they can be habit forming. And that's why they're a controlled substance. And a lot of people have concerns about taking them because they are a controlled substance. So, things to know about: there are other medicines that treat ADHD. So in another video I talked about Strattera, and this video is talking about Guanfacine. So what is Guanfacine? It is a medication that's actually been around for a long time. It can treat high blood pressure, so it's been around for blood pressure for a long time. Intuniv is a long-acting form that's taken once a day. That was just went generic, but that one had been kind of a pricey, newer medication that people really liked because it was just once a day dosing. So Guanfacine acts on noradrenergic receptors, so that's like norepinephrine, works on alpha 2 receptors. It's an agonist, which means it binds to the receptor and activates it. So this medication is known to help with blood pressure, can bring down blood pressure a little bit. It also can help a little bit with anxiety, and it can help with adult ADHD in ways that we're not entirely clear on how it helps. And I should note here that it's not FDA approved for adult use. It's approved up to age 18, but a lot of people can use it off-label in adults over age 18. So Intuniv can be a great choice if you're someone that's having side effects or problems taking stimulants. If you are taking stimulants and they're helping, but you notice that they're wearing off really quickly, or you need a little extra. So sometimes people take a stimulant and then they add on the Guanfacine to help boost the effects of the stimulant. It could be a good choice if you've had problems with substance abuse in the past and you're worried about taking something that's habit forming. It can be a good choice if you don't want to take a medicine every single day, but you still want to take a non-stimulant. So we had talked about Strattera. That one you do have to take every day. So Intuniv or Guanfacine or 10X work probably better if you take them every day, but you don't have to take them every day. So that's a pretty attractive feature for a lot of people. Another thing that's nice is you can notice whether they're working, pretty quickly within a few days, as opposed to, again, Strattera, you're going to have to wait probably 2 weeks before you see an effect. What are some of the side effects of Guanfacine? Most common one that I've seen is sedation. So that means, getting too tired or fatigued. Generally, if people take this, I recommend they take it at night, and that they take the long-acting form if they can. That way they have less of the sedation during the day. Some other common side effects I've heard from people could be dizziness, or just kind of being ineffective. So I think it's really important to understand about Guanfacine and Strattera and other non-stimulants, because a lot of doctors don't really know about using non-stimulants, especially if you have ADHD and you're being treated by your primary care doctor or your OBGYN. These are meds they're probably just not very familiar with. And even a lot of psychiatrists aren't familiar with these medicines. It's really more people who see a lot of ADHD or who kind of specialized in it or who follow the research who are going to know about it. So it's something that you should educate yourself on if you have adult ADHD or you know someone who does. And if you think this is a good option for you, or maybe solve some problems you're having in your treatment, you probably want to print out the information and take it to your doctor, because again, they may just simply not know about it or be thinking about it. So I hope this was helpful. Feel free to connect to us with the links below, and I hope you all have a great day. Bye-bye.